Everybody, it's Dr. Lee. I wanted to go over some really cool things about stress. This is probably the most stressful time we've ever faced in our lifetime. So we're all dealing with a lot of different things, a lot of emotions, a lot of stress. So I want to talk about how chiropractic relates to that and how your spine might be the most important factor in handling stress more effectively. This is a really great study, and I talked about this last week a little bit. In 2002, they measured 9 subjects over 5 weeks, and they wanted to measure their salivary cortisol. That means they measured their saliva, and they wanted to see how much of the stress chemical cortisol was involved. And they wanted to see before and after chiropractic care. They found that they had a significant reduction in salivary cortisol levels with chiropractic care, regular chiropractic care, just in the 5-week period. So if you can imagine a regular chiropractic care for years and years, how that helps you handle stress more effectively and how it reduces their stress response when unnecessarily overreacting to stress. That's an amazing thing. This summary was just a couple of years ago. They measured in men thoracic adjustments, meaning upper back adjustments, to determine whether chiropractic had any effect on cortisol levels. So they did an adjustment on a male patient, several male patients, and they found that adjusting the mid-back, the thoracic spine, resulted in an immediate reduction in salivary cortisol, which immediately and directly affects stress level and stress capacity, ability to handle stress, and it lasted for 6 hours on average after the adjustment. This showed basically that adjustments on a regular basis not only reduces your stress levels, helps you handle stress chemicals reacting to stress better, but also it impacts cognition, which is brain function, metabolism, which is dealing with digestion of food and food particles, absorbing nutrients, immune function, and response to any challenge that comes your way. And this is understood because when the stress response is greater, those other factors like immune, like sleep, like hormone regulation, digestion, those are all decreased when you're in the stress response because you don't need those to fight a bear. The problem is our bear nowadays is a chronic, constant reaction. It's constant and chronic stress. So that is what we're looking at affecting is the nervous system and how it handles your other functions, which would be stress levels better. Now, cortisol is very important, but it is directly related to blood sugar, immune response, bone remineralization, meaning bone formation and turnover, mood. I mean, who isn't affected by stress in a negative way as far as mood goes? And we all are. Deep sleep, and then protein absorption and breakdown. Cortisol affects these activities. Insulin, which is dealing with blood sugar, thyroid, which also directly affects metabolism and hormone regulation, DHEA, and testosterone. What happens when DHEA is decreased? The immune system reduces. Chronic fatigue, arthritis type pains, or degeneration type pains, increased libido, obesity, depression. You see there's many things, sleep reduction too, difficulty sleeping, falling asleep, and staying asleep. They did a study back in 2007. They found increased salivary cortisol levels in young people leads to depression. Well, duh, that's something we've known. Even a few years before that, cortisol actually linked to depression and psychotic behaviors or moods. Salivary cortisol increased in people that have panic attacks. So we know this is directly affecting your function, your ability to handle stress, your ability to deal with stresses more effectively if cortisol is high. So what do we have to do is help decrease that stress response. By looking at the spine and nervous system, we can affect that. If you look at a vertebrae here, you see there are 2 bones, 1 and 2, that meet together with a space between called a disc. There is an opening for the nerve to travel to what it controls, and this is directly connected to the spinal cord, which is directly connected to your brain. So when you have a misalignment or what we call subluxation, there's a direct effect on the brain immediately. Immediately it starts deranging brain signaling and affecting the way your brain is working. Immediately when there's a misalignment like this, where there's compression and irritation to the nerve, it increases the cortisol response because your body thinks it's in a bear attack mode or saber-tooth tiger attack or some major stress. When there's misalignment, it affects you and increases cortisol. What does that do over time? It wears down this joint and increases your body's cortisol stress level, which makes it harder for you to deal with immune responses. It's harder to deal with digestive. It's harder to deal with immune, reproductive, sleep, you name it. So overall function is decreased when there's subluxation. So what is our goal here? Check you, adjust you regularly, whether you hurt or not, so that you stay in optimal function, perfect brain signaling all the time. From when? From the beginning, or as long as you want to be well. So wonderful little summary here. You see what sends signals to everything else. That's the brain. And how does it send those signals? Via spinal cord. What is it sending through there? So nerve signals, transmissions, instructions to send to vital organs, heart, lungs, adrenal glands, which handle your stress, digestion. Every possible function in your body has to get signal from the brain through the spinal cord, which goes through the spine and out the openings of each spinal level. If we have misalignment in there, in any level, what is it going to do to the signal to the organ? Decrease that signal. And what does it do when it decreases that signal? Reduces the function of that organ. Over time, what does a reduced organ function occur in? How does it respond? Well, it shuts down. And when an organ shuts down, that's where we have health problems that are more chronic and more debilitating. And we don't want to wait for that to happen. So this is why we all need chiropractic care from the beginning, for as long as we want to be well. I'm Dr. Lee, your family wellness chiropractor. I'm glad you had time to listen. Handle your stress as effectively as you can. Take deep breaths, get some good rest, eat well, exercise, get adjusted, and stay adjusted. I'm honored to be your family wellness chiropractor, and I will see you when you're here.